The Ontario Pharmacists Association says there's a significant shortage of Tylenol and Advil for children. For a closer look at this, we're joined live now by Justin Bates, the CEO of Ontario Pharmacists Association. Justin, thanks for joining us to talk about this. So this is concerning because first there was that shortage of liquid pain reliever for kids, and now in the chewable form, which I believe is for ages 2 and up, but very convenient for kids that don't like the liquid form. You can taste like candy and they chew it. And now we're also hearing that there's a shortage of the supply that pharmacists have. So what are parents supposed to do?
There still remains some options, although they're limited because of the unprecedented demand that we saw in the summer, which is outside the normal consumption of these products. The manufacturers are trying to catch up. And our hope is that by mid to late fall, you'll start to see more shelves replenished with the child Tylenol and Advil formulations. But in the meantime, there's a couple of options. One, some pharmacies do compounding, so they have the raw materials like acetaminophen in powder format, and they can make a liquid formulation. So we would ask people to check with your pharmacist to see if that's an available option. The second is to look at the adult formulations, which are in tablet form. Speak to your pharmacist about splitting those tablets and either crushing them up and putting them into applesauce or other types of foods, or they can swallow it if your child can do that. So those are unfortunately the only two options right now when we wait for supply to be replenished.
Okay, you answered most of my questions there, Justin. Thank you. I was going to ask you about the adult-sized pills and what parents can do about that if there really is a shortage and they can't get their hands on these meds. In terms of restocking, I think you said mid-fall or late fall, it should be back to normal. How do we know that it'll be ready by then?
Well, we don't. I mean, there are possibilities where that could be delayed. What we do know is that the manufacturers have ramped up production, and it does take time in order for that to actually reach the stores, whether it's in convenience stores or pharmacies and elsewhere. But we do know that with the respiratory season, if there's another spike in COVID outbreaks, that could further delay things. We are putting in mechanisms to try to prevent hoarding. For example, putting these products once they come back to pharmacies behind the counter so that patients would have to speak to the pharmacist, and limiting it to either one bottle or one package per customer, and that will help. One thing I do want to say from a public service perspective is that we're seeing unfortunate situation on social media and other channels where some individuals are reselling what they bought at a much higher price. And what I would ask parents to do is be very vigilant. Make sure that if you are purchasing a product from someone that has bought it originally from a store, make sure that the seal isn't broken. That's very critical. And check the expiration date. But, you know, it's unfortunate to see hoarding, price gouging on resale. So we're doing everything we can with the manufacturers to ramp up production.
Yeah, scalping children's pain reliever medication, that is a new form of desperate and low, I would say. All right, Justin Bates, CEO of the Ontario Pharmacists Association, thanks for your tips and thanks for joining us this afternoon to talk about this. Appreciate your time.
My pleasure. Thank you.